Viral hepatitis is the inflammation of the liver that is caused by viral infections, and common viruses include hepatitis A, B, C, D, and E viruses. If the inflammation lasts less than 6 months, then that would be considered as an acute hepatitis, while if it lasts more than 6 months, then that would be a chronic hepatitis. Patients with acute hepatitis present with jaundice, which initially presents with a yellow sclera, and then later on it can manifest as a yellowish color of the skin. They also present with dark colored urine, and that is due to the presence of conjugated hyperbilirubinemia, right upper quadrant abdominal pain, nausea, vomiting, as well as fever. Some of these patients may also present with severe liver failure and the associated complications, and in this case it's referred to as fulminant hepatitis. Now, the common complications of the liver failure include bleeding, as liver is a site of the production of the coagulation factor. So since there is not enough coagulation factor, these patients will develop bleeding, which is usually in the GI tract. In addition, these patients present with the hepatorenal failure. So since there is a portal hypertension, there would be a systemic vasodilation, as a consequence of which eventually there would be a decreased renal function, and thus there would be increased level of creatine in these patients. And then finally, they present with the hepatic encephalopathy, and that is due to the increased concentration of albumin, which activates the inhibitory neurotransmitters like GABA. And one sign of hepatic encephalopathy is that they present with asterisks. So once you ask them to extend their wrist, you will notice that their hand is actually flapping. And then these patients present also with elevated ALT and AST. And viral hepatitis, ALT is usually bigger than AST, while with alcoholic hepatitis, it's AST that is usually higher. And then finally, in patients with chronic hepatitis, they could be asymptomatic, but in time they may develop cirrhosis or hepatocellular carcinoma. So in patients with hepatitis C, it's the cirrhosis that leads to the hepatocellular carcinoma, while in patients with hepatitis B, they could directly develop the hepatocellular carcinoma. In any case, next, I would like to go through this table and summarize the findings. So all of the hepatitis viruses, except for hepatitis B, are RNA viruses. And the family that they belong to, the mnemonic that I use is Pic hepatitis flavor. So PIC goes for picorna viruses, Pic hepatitis flavor. So here goes Hep adena virus family, and then flavor goes for flavi viruses for hepatitis C. And then for D, it's easy, goes for delta viruses, and then E goes for He viruses. Now, to memorize this table, I would like to just point out some easy points. So hepatitis A and E have many things in common, and it's that both of them are being transmitted by a fecal-oral route. The difference is that hepatitis E is usually from contaminated water, while hepatitis E is from raw shellfish. None of them are causing chronic hepatitis, and thus none of them are associated with hepatocellular carcinoma. While hepatitis B, C, and D, all of them are being transmitted via a parenteral route. In addition, hepatitis B can also be transmitted sexually, and thus it's seen in homosexual males, while hepatitis C is usually commonly associated with the transfusions. As for hepatitis D, it's dependent on the surface antigen of hepatitis B, and thus there must be either a co-infection or a superinfection of hepatitis B virus for Hep D to be able to replicate. And it's usually with co-infection, there is a less than 5% chance of developing chronic hepatitis, while with superinfection, which means that the patient had already had hepatitis B and then caught hepatitis D after that, there is about 80% chance of developing chronic hepatitis. So the way I memorize it is that Hep B and Hep D together are bad, and that it's the superinfection that is super dangerous. For hepatitis E, again, the way I memorize it is that it's associated with pregnancy. So pregnant is associated with hepatitis E virus. And then for prevention and treatment, you can provide patients with the hepatitis B vaccine, which is made of a hepatitis B surface antigen, while patients that have chronic hepatitis B, you can treat them with interferon alpha or lamivudine. While in patients that have hepatitis C, there is no vaccine because since it's an RNA virus, there's so many mutation rate, just like HIV, that the vaccine is not effective. And thus, if they have infection with chronic hepatitis C, again, just like hepatitis B, you can provide them with interferon alpha or treat them with the ribavirin. And that concludes our discussion.